tuning into Mirna. You're watching the Urban Debate. I'm Avni Raja, and our focus today is going to be the issue of migrant workers. We've been seeing over the last few days about how thousands and thousands of migrant workers from across the entire country are attempting to get back home on foot. They're willing to walk hundreds and thousands of kilometers to get back home because they don't have money, they don't have proper place to stay, they don't have jobs any longer. So all they want to do is go home. Meanwhile, of course, we know state borders are sealed. There's a complete lockdown in place at this point in time because of the coronavirus. And obviously, it seems like nobody thought it through as to what is going to happen to these migrant workers. And nobody thought about how they're actually going to handle this entire situation. So there was a last-minute scrambling of trying to deal with all of this. Last-minute buses were organized after thousands of people got together at borders, at various places, getting to places on foot. There were buses that were organized. Food and shelter homes are being created to help them, give them place to stay, give them food to eat. But at the same time, this issue is still far from over. While there have been certain steps that have been taken, there is still a lot more that needs to be done. And that is what we are going to talk about today. What is it now, at least after the first part? It is a policy disaster. It should have been handled much better. All of that should have been done. But now what next? Because there are multiple issues that are at play here. There's the risk, their own health risk by going in such large groups, the health risk of the people around them, the people in their villages, the spread of the coronavirus. So what can we do now to help them? And that is the big question. So let me welcome my panel who's joining in today. We've got Kannan Gopinathan, former IAS Officer, who's joining in. Neeraj Hatekar, Professor of Economics, Mumbai School of Economics and Public Policy. We've got Sanjay Kumar, former DG, NDRF, and Dr. Anand Bhan, Researcher, Global Health, Bioethics and Health Policy. Thank you so much, all of you, for joining in today. And first off, I just want to say that we really need to focus on what are the solutions now, what next needs to be done, because at this point in time, there are all of these people on the streets, on the roads across India, with perhaps don't know how to get to their homes, don't have food to eat, don't have money. So there are a lot of issues that need to be dealt with. So Kannan Gopinathan, let me start with you. What, according to you, needs to be done now on a war footing, because there are so many issues that are at play here?
Yeah, hi. First of all, thank you for having me on the show. See, what we need to do right now will depend upon what is the plan for the lockdown. We cannot have a plan for just tomorrow, because if we are going to have this lockdown only for 21 days, then our plan would be different. If this is going to be a prolonged lockdown, then it is going to be different. And if it is going to be a staggered one, like 21 days, then maybe a 5-day break, and then there is going to be another lockdown, then it is going to be different. So we need to be clear as to what is our plan regarding lockdown. Because this is not an isolated issue of dealing with the migrant labor, because migrant labor, anyway, it's a seasonal migration also time, because this is Rabi harvesting time. Anyway, a lot of migration happens during this March, April from the cities to the rural areas during this period. So connected with this migrant issue is also going to be an agricultural labor shortage in the rural areas. So for the Rabi harvesting time. So the government needs to actually sit through and decide as to what is it going to be. If it is going to be a 21-day lockdown only, then maybe temporary relief shelters at all the places wherever they are and accommodating them there, giving them the food, giving them immediate assistance would be of help. But if it is going to be prolonged than that, then keeping a lot of healthy people together in relief camps itself is going to be a disaster, because there is going to be a prevalence of diseases and other kind of things, even not exactly COVID, but there could be other diseases also that could come in those relief camps, and you will see a lot of issues happening in the relief camps for a prolonged stay, and they are healthy for that. So immediately, if the government feels that we are not going to end this lockdown in 21 days, or we are going to go for a staggered one, or going to be a prolonged one, then if going to be a prolonged one, then immediately take a 5-day break is what I would say, and then go ahead and let the migration happen. If possible, have the quarantining done at the district level where the receiving is happening, if possible. Otherwise, If it is just 21 days, then okay, go ahead and have the relief that can be done. But at any cost, include the local self governments at all levels, from gram panchayat level, from ward level, to the top, that is a district panchayat or a municipal corporation. At all levels, include decentralize the process rather than centralizing it. And that is the only way to go about it, is what I feel. The migration happens for a lot of work, be it construction, be it textile, be it brick kiln, be it domestic. And if we are not allowing this migration, then we are going to see a huge urban unemployment and hunger crisis that we are going to see. Even if the lockdown is immediately lifted, none of these people are going to get these jobs at front. So we might also need to parallelly plan for a demand-based job guarantee scheme like an AREGA for the urban areas as well. Because the issue why we are facing this today is because we did not think about the reverse migration that could happen once the cities locked down. We should not do the same
Yes.
mistake and discuss maybe that what we need to do today. But because this is going to be a prolonged battle, we need to think maybe a month ahead and plan it accordingly. That is my remarks initially.
Yes, absolutely. All right. In fact, Dr. Anand Bhan, if I can come to you here just to take off from the point that Mr. Gopinathan was talking about, if it's a 21-day lockdown, if it's going to be longer, the solutions need to be based on that. But at this point in time, it's very difficult to sort of assess what's going to happen, where we're going to be as a country, where we're going to be, world over in the next 2 or 3 weeks, where the numbers are going to be. So, given this uncertainty that we are in at this point, that we have at this point, what in your opinion should actually be done to deal with the situation where there are so many people still on the streets, there are others who want to go and are adamant to get back home?
Sure. Thank you for having me. I think so. It's clear that, there has been a bit of a lack of foresight in the way we did not predict that we were going to see this kind of a human catastrophe happening. And that probably is something, which is staring us in the face. As you showed visuals of people lining up for trying to get across borders, people who were being treated very, almost like cattle by being sprayed with bleach, which, is almost like a human rights violation by itself. But more importantly, the fact that now you have such a large collection of individuals and families which need basic services, access to food, water, access to communication, access to health services. It's not just a matter of, putting people together in a stadium or in a makeshift shelter or in a school, but you need to also make sure that they have access to all of these services, because that by itself, as Kannan was saying, could also turn out to be a public health, issue if we don't take care of all of their health needs as well and prevent any further spread of both COVID-19 as well as any other health problem. Now, it might be incumbent, I think, to think through what might be the solutions. I think one way of looking at what happens in such kinds of situations when, say, you have a natural disaster might give us some ideas. So if you can leverage the state disaster response teams, the national disaster response teams, to look at their presence locally in and around these areas. If you have volunteers available, either the Home Guard or other sort of civil society organizations that you can work with, you need to be certainly working with them. But this cannot be key. This cannot keep going on. You cannot have people stuck in limbo in one particular place, somewhere in the middle of where they were working economically and where they want to head back to in their homes, because they might have aged parents to look back, take care of when they go back home. They might have fields to till, as they might have just an emergency to attend to. So at some point of time, they would also need some security of understanding as to when can they get back to where they belong. And that, I think, is important for us to think through, and we find pathways towards that. It should not be the case that it seems that there are two standards. One standard for those who were stuck in foreign locations, and we had rescue flights going out for them to bring them back, and then making sure that they reached back home safely.
Yes.
And another standard for those who are the bottom of the pyramid. I think that would reflect very poorly on us as a nation, and would reflect very poorly on how we treat those who make things happen in our cities. These are the same individuals who make cities run. It's just that in our middle class localities, we just probably behind the gated communities just don't care enough about them. And this is a time to actually show that care and ensure that we treat them as just basic, human beings, and our response should be based in humanity and based in evidence. So, it's very important that now that this tragedy is upon us, that we make concerted efforts to respond to it.
Yes, absolutely. I completely agree with you there. Sanjay Kumar, coming to you here, obviously there is a lot that needs to be done at this point and immediately on a war footing. But this is a very difficult situation, whatever, the failures may have been in foresight in terms of trying to deal with the situation. The situation we are in is extremely difficult for anyone, for any government to sort of deal with. So it would require some sort of innovative thinking, some sort of out-of-the-box thinking. What, in your opinion, sort of needs to be done right now?
Yes, I fully agree with the co-panelists. They have described it aptly. I think it's a long-term process. You might have noted that when it was a one-day affair, the Janata Curfew Day, the people's response was quite automatic. It was self-propelled. But when it came to the longer term, some of the deviations have come to notice, and one of them is being discussed today. The restrictions have been imposed for the purpose of social distancing, and it was under the Disaster Management Act that all these impositions and all those provisions have been imposed. However, the emphasis has shifted from the implementation of the Disaster Management Act to the law and order problem. We are trying to enforce the curfew. We have proclaimed provisions of under 144 and trying to impose it as if the law and order situation is there. The difference has to be made out. NDMA Act clearly lays down the provision of the incident command system to be laid down. Incident command system is to be set up, and there is an incident commander, and that is for right from the local level, the smallest of the unit, to the state level. Had this been the case, such a situation would not have arisen, because all those things are taken care of which are needed in a situation like this, the disasters, the administrative aspect, logistics, their food, shelter, etc. Moreover, in such a situation, the supply chain was broken. Whatever might have been a region, we didn't have experience, we didn't have foreseen the situation for long-term kind of these measures. Those were the provisions because of which the large number of the workers were rendered jobless. They have little money, little food with them, and most of them eat in the eateries nearby, which were closed due to the problems of infection getting spread. All these things were combined. These led to the compounding of the situation and the fallout, whatever was seen. It was heart-wrenching scene over there. Now I think we should try to persuade them, and we are coming to terms gradually. Those things are to be settled right now. Even the teething problems are getting over. Those people should be assisted wherever they are. They should be housed in a camp, looked after, social distancing, the basic purpose should be enforced over there. And after 2 or 3 weeks, the hot spots would be able to be identified, I think. Those hot spots only need to be confined or quarantined, or the social distancing measures are to be implemented locally. This will facilitate us for their movement if we are not going for a long-term kind of closure, lockdown.
Right. Okay, Professor Hatikar,
yes.
What is your opinion on this? Do you believe that the states at this point in time are doing enough? Because there's also the other issue where a lot of people on ground, the ground administration don't seem to know how to deal with the situation, and you end up having issues, situations like chemical being sprayed on migrants, workers who are entering certain areas, which is absolutely ridiculous.
It's not only ridiculous, absolutely inhuman and despicable. This should not be done.
Yes.
That's not acceptable in a democracy like ours. Having said that, hello, having said that,
Yes, please go ahead.
people are moving because they're facing an unprecedented uncertainty in their lives. They have no jobs, they have no income, they can't pay rents, they can't buy food, and they don't know when this will end. And that is what is propelling this movement back. Now, today apparently it seems that the government has said that the lockdown will not be extended beyond beyond 21 days. If they have said that, then they have to emphasize that. The political establishment has to come out and send that message very clearly. Look here, the lockdown will certainly end on 14th April. If that if that is said with conviction, that message goes to people with conviction, they know it's a matter of 2 weeks. Some people might also want to return from where they are because they are just going because they don't know when this will end. So that return, if people want to return, then we should also make arrangements for people to return. And, that should be facilitated. And then we should ensure that while they are there in cities for 2 weeks, they are looked after. That's one important thing that needs to be taken care of. Secondly, what's happening is, there are lots of people who need to be looked after, not only their transport, but also basic health care. There are COVID, Corona is not the only public health disaster problem that we have. For example, there are people who are suffering from tuberculosis, and somebody might be continuing treatment in Delhi or Mumbai hospital, and now suddenly find that the treatment is discontinued and the person moves back. So there are other kinds of, health issues that might come up, and that also needs to be looked at. Finally, I think when we are ending this on the at the end of 21 days, at that time also people will want to move back, and again there will be a similar kind of a similar kind of a chaos. So we also need to sort of plan for the end of the lockdown. So I think we need to be very clear, set the message that the lockdown will end on 21st and they will not be continued. People need to be given the confidence that they can come back. Those who want to come back need to be persuaded to come back to their cities because it's a short duration kind of a thing. That situation needs to be dealt with like that.
Yes, fair enough. I think the planning aspect is something that really needs to be done at this point in time. But Dr. Anand, I want to come to you here. It's understandable and fair enough that we need to plan, look ahead, plan after what's going to happen at the end of the lockdown period. But even though, there has been a comment that's come in from the government that there is no plan to extend the lockdown, it would sort of at this point in time not be right to assume that 21 days is going to be the end. We don't know the situation. There is too much uncertainty both in India and outside the rest of the world. So trying to put a number to this saying 21 days and that's going to be it. It's not going to end in 21 days. Coronavirus is not going to stop spreading. These risks will not just disappear overnight. So given that situation now, obviously the migrant workers are also left in that state of uncertainty about whether to go back, whether they will be returning, what happens to their jobs, all of that. So with that uncertainty, then, how do you deal with that?
Yeah, absolutely. I don't think there is a magic number. You can't predict in 21 days that we will have, fair resolution of the spread of COVID-19, and that that would be enough for us to then go back to normal life. It's not going to be the case. And actually, what we should worry about is any kind of a rebound which happens in a scenario like that. Having said that, maybe the approach needs to be a bit more strategic, which is to say that a national lockdown has been decided as a policy and it's being implemented now. Moving forward, if we take advantage of this time period that we have while ensuring that all of those who've been so negatively impacted by the lockdown, we have enough examples already discussed, are taken care of. They are given assurances that they will be provided for, that their needs will be taken care of, and they would be taken to whichever destination, either their home destination or where they were working earlier once the lockdown ends. But what's also important is planning forward and saying that what is going to happen after 21 days. If there are still pockets of infection which you've identified during these 21 days, then will you continue lockdowns in particular localized areas, which is a more strategic way of applying a lockdown, which, for example, was done in China, where they had, which was more localized around the Wuhan area and not spread all across the country. And then taking advantage of that, then they put in strong public health measures. They brought in extra staff from health systems to help out with the surge in the local hospitals and healthcare centers. And then they did very aggressive testing and tracing of those individuals who might have the infection or might have come in contact with someone with infection. But a national lockdown beyond 21 days is going to be difficult. It is going to have a lot of repercussions on certainly on public health, on the economy, on the way we live our lives, and so it will really need to be thought through. Having said that, I don't think even the government is making a statement today, but I don't know if things change over the next 2 weeks, 10 days, 14 days. They might have to relook that decision and come up with a different approach, because we don't really know what the public health status might be of COVID-19 2 weeks from now. So it's important for us to make sure that we are cognizant of that.
Right. Yes, absolutely. Kannan Gopinathan, there's the other very important issue here, which is that when all of these, migrant workers actually get to the villages that they are in, living in, get to those levels, there are a lot of people who don't know how to deal with that situation. So you have the district level administration who is completely clueless about how to deal with it, whether to put them in shelter homes altogether, whether to quarantine them. And then you have situations where, for example, the chemical disinfectant is sprayed on these migrant workers, which is absolutely not done. It's completely inhuman. So at that level, how do you, sort of ensure that people are aware at all levels on how to deal with this kind of a situation?
See, first of all, I agree with you. As of now, we don't know what to do with them if they are not migrating, and we also don't know what to do with the migrants if they are actually migrating and they reach the villages. But my first submission would be that every day of a lockdown, while it allows the government to ramp up the state capacity, it also severely drains the capacity of the society in general and the poor in particular to deal with the crisis. So the migrant labor that you're seeing right now, when they are not having their food, when they are not having their social security net, their emotional well-being, their own psychological well-being, their economic well-being, their social well-being, their physical well-being, nutritional everything is going down every day of a lockdown. So first thing, if we are actually serious about this, is that assume that for 3 more days this lockdown is not in force, and let the migration happen, because in the villages is where they will find their social security net. They will not get that in the urban areas. If at all, if we are going to provide that in the urban areas, it is going to be in kind of relief camps, which is going to be another disaster of another scale. Let's assume one coronavirus spreads in one relief camp, and then we are going to shut it down, and then we are going to move to another. So that is why we are, I'm saying this again and again, that trying to see at it from a district level or a local level, that what we do right now may not be the correct approach to it. First is to take a call, because 21 days we are just going to do a 21 days lockdown, and we do not have the criteria. The government has not been transparent, or we also don't know the criteria as to on what basis we are going to decide whether the lockdown is going to be extended or not. Almost 30 states are already affected, unlike the case in China, where it was a localized disaster, and the entire nation could actually mobilize to deal with the localized disaster. So the entire China could mobilize to deal with the disaster in Wuhan. Whereas for us, we have a nationwide disaster. They spread across the states, spread across the cities. And so we might not be able to mobilize it and respond to it in that way. So my first and only submission is that just assume for 3 days or 4 days time that we had delayed our lockdown by 1 week. Maybe we would have lost all the thing that we have done during this 1 week. But without that, we are going to see a similar kind, because 21 days is not going to give us a picture on any of these aspects. So as you rightly said, even the government today is saying that 21 days is, there is no plan for 21 days. The similar kind of a statement was made during Janata Curfew also, that there is no plan for a prolonged lockdown at that point of time. So we don't know. And it is understandable that government does not want people to panic. And so hence the messaging is this. But people also have a right to be transparent and to know, because it is affecting their lives. And they do have a right to take a decision, knowing that what the future is holding for them. Otherwise, we might be hoodwinking them and trying to keep them in immediate temporary things without actually dealing with the larger issue, without actually dealing with their larger health issues, larger migration issues, none of that. And this is seasonal, and none of it is not the case that it could have been predicted. March, April time is when the seasonal migration happens in a lot of, because of the rabi harvesting season. We need to be clear on that front also. Second part is, okay, if let's assume the migration we are allowing, then how do we deal with it at the village level? So this is again difficult to provide for a quarantine or an isolation at every district. It is not possible. What we can do is that at the local level, at the village level, have a resource person, have a point of contact person, maybe ask them to identify a home in every village, every village identify a home where we vacate and make some space for them, so that in case of a requirement, in case of showing of some symptoms, they're immediately shifted there, and then further the the identification of the disease or the testing is done. But right now we are not testing and identifying the clusters and putting the data out for this decision to be made as to whether a 21-day lockdown is going to be there or a 50 days, because this is crucial. Without that information, without that underlying assumption, the discussion that we are going to have or the solutions that we are going to give might actually end up being counterproductive or become another bigger problem in itself.
Yes, fair enough. But the only problem with that is that information. I mean, the government may not themselves know whether what's going to happen after the next 2 or 3 weeks, where we'll be, how our numbers will be, because obviously it goes without saying that the next few weeks is not. There's no magic number. There's no magic date by when this is all going to be all fine and we can just go about our daily lives. This is going to be an extended, prolonged process. To what extent, we all don't know at this point in time. But, Sanjay Kumar, given the uncertainty that all of this is in right now, what, in your opinion, needs to be done in terms of should the migrant workers be sort of, stopped wherever they are right now, and whichever state they are in, that state takes the responsibility of providing the shelter homes, providing the food, providing whatever is needed for them to sort of be safe and stay there in one place? Or should efforts be made, as has been done over the last couple of days, for buses to take them back home?
Yes, I think the migrants workers' need has to be addressed properly. Now that the social distancing is the only measure that we can take in the present circumstances to keep us away from the exposure of the contagious disease, the migrant laborers have to be restricted to the camps wherever they are. We have still 2 weeks to go during this lockdown period of three weeks, and after that, I'm sure the reviews will be made. Depending upon the reviews, we will be able to identify the hotspots, and we can limit the lockdowns to the hotspots and gradually open up the areas. If for the longer period, still we will be able to assess the need of those stranded laborers or the guest migrants over there, and then accordingly take decision. If it's going to be very long period and they have not been exposed to the disease, they can be let off. Some arrangements can be made for their movement to their homes, wherever they like, or to the safer places. Or else, if there is no need, no alternative, then we can restrict their movements and keep them in the camps. It's in their interest as well as in the interest of the society to prevent the spread of the disease.
All right. Okay. I just want to, shift focus a little bit to another very important point here. And Professor Hatikar, I want to start with you on this point, which is the last mile connectivity. Which what I mean by that is the fact that there is an economic package that has been, announced about money being given, free ration, and free gas cylinders. But when you have so many migrant workers on the roads, what help is all of that going to be? What good is, 10 kgs of uncooked rice or wheat going to help them when they, or gas cylinders going to help them when they're not even home, when they're on the road. So somewhere there seems to be a disconnect between what is actually needed to help them and what is being done.
Yeah. This package of 1,70,000 crores is actually absolutely inadequate because, you know, what you have is basic subsistence rations, but even rolling that out is going to take a longer time. And we don't really have, as you correctly said, the last minute mile connectivity. So many people don't even have Aadhaar cards, or many migrant workers don't have ration cards. So it's going to be difficult to deliver those goods, that relief package to them. I think it would be much better to stop people if we are in it for the long haul, as we all seem to know. Then it's the best policy to stop them wherever they are, keep them in camps, provide all the necessary health facilities, food, and other necessities there in a directly delivered way, rather than through the packages, because the last mile connectivity will be difficult. So I think that's the only way to deal with the situations of now.
All right, I think we've lost that audio connection. We'll try and reconnect with Neeraj Hatekar. But let me, in fact, go
Hello?
back to Kannan Gopinathan on this very question. Professor Hatekar, can you hear me?
Yeah, I can hear you now. Hello?
Yes, please go ahead. Please go ahead.
Hello?
Yes,
You see,
Professor Hatekar, please go ahead.
The last mile connectivity is rather poor. Even rolling out the schemes fully and actually accessing people at the end is anyway going to take 2 or 3 weeks, even if we work at it very efficiently. So it doesn't seem to be really something which would help us in the current situation right away. Despite the package of 1,70,000 crores, it's not really going to help you. So what you need to do is to look at people wherever they are as of now and stop them and make sure that they get all the basic necessities like food and basic health care, because they're carrying children, they're carrying elderly, they walked for a long time, they're malnourished, some of them might be ill, they might be having other illnesses. So I think that critical care needs to be taken for people wherever they are, because it seems that we are in it for the long haul. Even if the government says that we are going to not open it on 20, I don't think any serious political establishment has still taken that position. So nobody knows. And given this, I think the best strategy is we can't depend on this last mile, the delivery of this package.
Yes, absolutely. Kannan Gopinathan, do you agree with that? That they should just be stopped wherever they are at this point in time and taken care of by whichever state they are in, not get into whose responsibility it becomes. Obviously, because at this point in time, that's not at all important. They need to be taken care of right now.
See, there are two ways to look at it. That is from the migrants' point of view, that the migrant labor, as whether what is it he is going to feel comfortable, whether he is going to get food, whether he is going to get his basic amenities. So you look at the construction migrant labor. Where is he normally staying? He is staying at the construction site. You would find a lot of tin sheds across, and then the entire family staying there. And that is his. But he knows that he is there only for temporarily. He comes there, he works there, and then from there, whenever the rural the labor comes up or work comes up, he goes back, or festival, he goes back. But now he has an anxiety, he has an apprehension that he's stuck there in those tin sheds. And when there is a huge disease that is spreading across the country, and he does not have any support system, government will not be in a position to provide the support system that his family and that his society, that is a village, is going to be able to provide to him. It is not possible. The capacity erosion that is going to happen in the society during this period will not be able to be compensated by the capacity addition in the state, in the government. It is not possible. So my humble submission is, again, if at all is possible, is that we should allow the migration to happen, the population, because otherwise it is just the moment you say that it is going to be more than 21 days, again you will see the same kind of migration. And now it is even going to be more dangerous, because you would have actually allowed 20 more days to go, and by the time the things are about to settle down, you are going to see another wave of migration, and which is going to further spread to various other places. So you would actually be making a policy after 21 days if you're going to allow this migration, then saying that okay, let the spread happen after 21 days. So if at all, and I think it has nothing to do with the number of cases being reported or the number of positive detection rate or anything. 21 days is not sufficient period to contain the situation when it is a nationwide situation. 21 days is not going to be enough to test and isolate, treat and trace every single family and during this period. Just assume even one undetected case is there after 21 days and we are going to open. Let's assume there is one undetected case and he is going to, during this period, assume a 5% immunity develop. He is going to meet 20 people and 19 people are then susceptible to get this again at that point of time. So we need to be clear on this, and that's where government also needs to be a little more transparent when they're telling whether it is going to be a 21 day or not, and it also need to tell it to the states and the district administration everywhere. See, we are going to be in a prolonged situation, so the best, we would like to be in our home at this point of time. We would not like to be stuck at any other place when we are in a position of lockdown. We are isolated. We are, so it's the same case with migrants. It's the same case with laborers. They are also just like us. So it's not the case that we can put all of them. Then they are crores. It is not just they are in very limited number. The moment you start providing relief camp measures and facilities, then you would see the more and more number coming up also. It's just like when you started providing the bus facility for the migration, then you actually saw how many migrants are there. Till then, we are not even seeing because it was completely invisible in the city. The moment you saw that, okay, we are going to provide you some facility, yes, then you show that the people started coming out. I think we need to allow that to happen. They should also feel equally comfortable. Assuming, and I'm still assuming, this 21 days is not sufficient, irrespective of the rate, irrespective of the spread, irrespective of the rate of increase or decrease in the cases that we are going to see. We should ideally. Otherwise, we are just going to delay and the spread. We are just going to delay the spread. And during this delay, we have eroded the society's capacity while we have not ramped up the state capacity enough. And that is a scenario we are looking at.
Right.
So I think again, this thing is that okay, you should let them be at a place where they're comfortable.
Okay. Dr. Anand, your perspective on this specific issue about the fact that this economic package that has been announced, a lot of people are of the opinion that it's just not enough. This 500,000 rupees that people are going to get in their bank accounts, A, is not enough. B, how is it actually going to reach them? Because the fact is that so many of them don't have Aadhaar cards, so many of them don't have bank accounts. A lot of issues are there in actually getting this to them. And secondly, the fact that with all of them, so many of them on the roads, how is ration and cylinders going to actually help?
Yeah, all good points. So, let's remember a few things. One is that this is not any routine migration. This is a migration due to COVID-19. Secondly, why was this migration caused? This migration has been caused because there was a lockdown, which was a public health measure, which was instituted at a national level. So there are, the causative factors for the migration are quite clear. And if that is the case, that it is because of a step by the state, then the state has a clear responsibility to respond to the needs which emerge from that kind of a migration. And that means that all of these individuals and their families need to be taken care of, just as we would take care of anyone who's been impacted negatively by a natural disaster. They need, obviously, access to food, safe water. They need access to health care. Any of them, if there are pregnant women, they need antenatal care. They need delivery care. Kids need vaccination. Those who might have nutrition issues, there is a lot of malnutrition already, especially in people who work on a day as daily wage laborers. We need to address that, and this needs to be done now. It's not for us to plan in the future and say when you get wherever you will have a gas cylinder waiting for you or you'll have X amount of food waiting for you. It needs to be done now because that is the only way they will feel that the state is taking care of, and that is also a very important measure from a COVID-19 response perspective. Because only if they believe that they are being taken care of, then 21 days down or 30 days down the line, if and when there is a situation that they exhibit any symptoms of disease, they will reach out and self-identify. If they feel that the state is going to abandon them and they get that feeling of abandonment now, that could potentially spell disaster. Because tomorrow, if I have that feeling, and if I in the future have any kind of symptoms or I see someone with symptoms around me, I will not reach out to the state because I will feel that in any case they don't care about me. So I might as well stay on my own and not bother. And that could be a major problem from an infection spread perspective. Only those individuals and families and communities which trust the government and the state will effectively partner with them in public health measures. And if we want us to succeed in our response to COVID-19, it's imperative that we build that trust. And that trust can only be based on ensuring that we take care of those who are the most vulnerable at this point of time, provide for their needs, and ensure that they have a future to look forward to, and that they are not abandoned at any point of time.
Yes, absolutely. Extremely, important that we help them feel that they are important and they should not at all be abandoned or feel abandoned right now. But Sanjay Kumar, of course, from a disaster management perspective, this issue, what we are going through today is unprecedented. It's extremely difficult to deal with and manage. But if you had to sort of look back and, some lessons that should perhaps be taken into account from earlier on, that were learned earlier on, that should sort of be looked at now and learned from at this point of time, that can be put into use right now, what would that be?
I think it's an unprecedented phenomenon this time, and the whole nation is under lockdown simultaneously. The response has been perfect from the government point of view, but then the scale at which we are dealing with the issue have different repercussions. It's not easy to confine the people in the small houses, the small rooms shared by many, or even people are alone. They have their mental and physical health issues as well. They cannot move around, and so on, even if they are healthy. Therefore, in such a situation, it's imperative that we identify the problematic areas, the hotspots, as soon as possible. It has its own time period. It is 2 to 3 weeks. And during the 3 weeks, we'll be able to identify the hotspots, let those hotspots be locked down, and others be freed gradually. Their movement should be allowed. It's not a rural area. Basically, these problems have been identified in urban areas, and where the people are actually locked down, confined in small places, and they have so many issues, particularly with the situation we are discussing today. They have their different issues. Collateral damages are heavy, may it physical, mental, or social kind of separation. Those issues have to be addressed, and that's why I have suggested in the very beginning that the disaster management aspect may be dealt with as per the conditions laid down in the Disaster Management Act, as per the provisions incorporated therein, and the incident command center should be located in each and every area, and the response should be as per the need of the local area. Let it be coordinated with the higher authorities so that people feel easy. The confinement or the identification of areas, hotspots are easier, and treatment is easier. Responding to the needs of logistics, administrative, etc., health issues are easier. Then those agencies which are involved, I think initially they had some issue in comprehending the issue, whether it's how to implement the social distancing issue. They could mistook it for the law and order issue, and most of the enforcement aspects, as we have seen in the media as well, that they try to enforce as if it is a law and order issue. So those are the lessons to be learned.
All right. Yes. Right, absolutely, Sanjay Kumar. We're completely out of time. Thank you so much to all our panelists for joining on the debate tonight. But obviously, this is an extremely crucial issue. It has not, let's remember, this has not been dealt with well. It has not been, there was no foresight to deal with this situation, no planning at all. It was a disaster. But we are in this situation now. This is an unprecedented situation. And it is extremely difficult for any government to deal with, to manage a country like India during a lockdown, the various states, the various entire population of the country. So whatever it is at this point in time, a lot needs to be done to ensure that the migrant workers feel that they are not abandoned. They should not feel abandoned. They need to feel that they will be taken care of. And every state, at every district level, at every state, at the center level, they need to come together, and all of us as well, whenever we can, do help these migrant workers. But slip into a quick break and come back.